From NBC News, this is Today with Bryant Gumbel and Jane Pauley.
On Today's Health, rosacea, a skin condition that afflicts about 5 million American adults. Dr. Ulene is in our Burbank studio this morning with some advice on how to recognize and treat it. Good morning, doctor.
Good morning. Rosacea is similar in some respects to acne, but it strikes after adolescence. Because of the way it looks, having rosacea can be just as upsetting to an adult as severe acne is to a teenager.
The famous W.C. Fields nose, which most people attributed to excessive drinking, was in reality probably caused by rosacea. Although Fields was able to capitalize on his nose through humor, rosacea is anything but a laughing matter for others. Madeline Coit's first outbreak of rosacea occurred 3.5 years ago, with the appearance of pustules on her face.
The rosacea feels like a burn. And I once was burned, and it feels just like that. It's painful. And I think it makes people uncomfortable. They either feel sorry for you or they think you haven't washed, one or the other.
Madeline is an artist, so she thought the problem might be due to a toxic substance she was working with. When facials and repeated washing didn't help, she wisely sought a dermatologist's advice. The cause of rosacea is not known. In addition to the pustules, it tends to cause redness of the skin over the forehead, nose, chin, and cheeks. In part, this is due to abnormal dilation and reactivity of tiny blood vessels in the skin.
What is thought to be a very important part of rosacea is what is called the vascular instability of the skin, where you get a lot of blood vessels in the skin that become widened or dilated, and this may lead to a leakage of inflammatory chemicals into the skin that then leads to the lumpiness and the pustulation.
Dr. Nicholas Lowe prescribed metronidazole, an antibiotic type of medication in a gel form called Metrogel. It was the first thing that worked for Madeline, though it certainly isn't a cure.
It keeps it under control. I still have breakouts. I can't time the breakouts to anything that makes any sense. Doesn't hit anywhere consistently in any kind of rhythm.
Some patients will go into periods of long-term improvement lasting several years, and then they'll get a recurrence of their rosacea. Other patients, their rosacea just is, as soon as they stop their treatment, it returns.
Even if the pustules clear up with Metrogel, the dilated blood vessels that make the skin look red remain. Here's what 22-year-old Robert Scholler looked like when he started therapy with Dr. Lowe. Robert's condition improved greatly after treatment with Metrogel and other medications, but the redness due to the dilated blood vessels persisted. You can see what laser therapy has done for that.
I feel it's probably in the neighborhood of 80% cured. No one comments on my nose anymore, and anyone who had seen it in its red swollen condition feels it's been cured. We're going to do one more round with the laser just to get a few spots that we can see, even if a lot of other people can't, and that hopefully should do it. And I'll be able to close the book on this not fun experience.
Though there's no cure for rosacea, early therapy is important to prevent the scarring and nodules that can develop if it's ignored. If you have severe acne-like sores that don't respond quickly to therapy, I'd recommend that you see your family doctor or a dermatologist without delay. Mary Alice?
Thank you, Dr.